Question number 301. Nurse researcher tells the participant that their identity will not be linked to responses. So which ethical principle is demonstrated here? So A, privacy, option B, debriefing, option C, anonymity, and option D, confidentiality. So option C, anonymity is correct answer. Question number 302. Patient tells the nurse researcher he or she wants to stop the research participation. So which of the following is the most appropriate response? So option A, you can quit at any time. Option B, you cannot quit at this time. Option C, you have to finish the research. And option D, you must have the good reason to quit. So option A, you can quit at any time is correct answer. Question number 303. A nurse researcher asked the charge nurse to obtain the patient consent. So which of the following is the most appropriate action here? So option A, invite the nurse researcher to get the patient consent directly. Option B, make sure patient understand before signing. And option C, give the consent form to patient for review. And option D, read the consent form to the patient. So here option A is correct answer. Invite the nurse researcher to get the patient consent directly. Question number 304. Which of the following can be considered as a major development in the nursing home visit in terms of information technology? So option A, medical dispensing. Option B, telehealth. Option C, patient monitoring. And option D, prevention of epidemiological disease. So option B, telehealth is a major development in the nursing home visit in terms of information technology. Question number 305. Which of the following prevents the conflict, frustration and overlapping of duties? So option A, need assessment. Option B, job description. Option C, performance appraisal. And option D, organization structure. So option B, job description is correct answer, because to avoid the conflict, frustration and overlapping of duty, the job description will help to prevent such type of conflicts. Question number 306. Where should the repeated observation and measurement such as a vital signs be documented on the system? So option A, medical examination. Option B, medical history. Option C, progress report notes. And option D, graphic sheet. So usually we'll document the vital signs on the graphic sheet. So option D is correct answer. Question number 307. As an informatic nurse in the hospital, so what is the most important factor to patient data in your database? So option A, security. Option B, relevance. Option C, accessibility. Option D, transferability. So option A, security is correct answer. Question number 308. A patient on the monoamine oxidase inhibitor complained from the severe occipital headache, palpitation, vomiting and chest pain. So what immediate action should be taken? So option A, hold MAOI. Option B, give phentermine. And option C, reassure the patient. And option D, provide cooling blanket. So option A, hold the MAOI, because these are the severe condition in which patient can experience hypertensive crisis. So we need to hold the MAOI. Question number 309. A patient was brought to the emergency room by the family member due to the severe agitation and insomnia. So which of the following is the most appropriate medication to give here? So option A, lorazepam. Option B, clozapam. And option C, propranolol. And option D, haloperidol. So option A, lorazepam is correct answer, because it acts as an anti-anxiety medication. Question number 310. A nurse was assessing his patient for medication side effects. So the nurse concluded that the patient has developed the extrapyramidal side effect. So which class of medication can cause this side effect? So option A, anti-anxiety. Option B, antipsychotic. And option C, mood stabilizer. And option D, antidepressant. So option B, antipsychotic medication usually cause the extrapyramidal side effects such as akathisia, pseudoparkinson. Question number 311. While assessing a patient with mental illness, the nurse noticed he frequently uses the unknown word with no common meaning or understanding except for himself. So which of the following is the most likely disorder here? Option A, blocking. Option B, word salad. Option C, retardation. And option D, neologism. So option D, neologism is correct answer. Question number 312. During a physical examination of the patient with mental illness, he panicked and pointing at the nurse's stethoscope and said, "There is a snake around your neck. Save yourself." So which of the following symptom reflect the patient perception? So option A, illusion, option B, obsession, option C, hallucination, and option D, depersonalization. So option A, illusion is correct answer. It's a perceptual disorder with the presence of external stimuli. Question number 313. Following a lumbar puncture, a client comes up with several complaints. Which complaint indicate to the nurse that the client is experiencing complication? So option A, my throat hurts when I swallow. Option B, I have a headache that gets worse when I sit up. So option C, I feel sick to my stomach and I'm going to throw up. And option D, I'm having pain in my lower back when I move my legs. So option B, I have headache that gets worse when I sit up is main complication usually patient experience after lumbar puncture. Question number 314. While interviewing the client with schizophrenia, which behavior required immediate intervention? So option A, rocks back and froth in the chair, and option B, muscle spasm of the back and neck. Option C, shuffling gait and stooped posture. Option D, lip smacking and frequent eye blinking. So option B, muscle spasm of the back and neck is correct answer. Where usually we'll call it lethal catatonia. Question number 315. A nurse in the mental health unit is reviewing the diet restriction of the client who's taking the MOH. So which symptom could occur with non-adherence to the diet restriction related to MOH? So option A, akaesthesia, option B, agranulocytosis, option C, severe hypotension, and option D, explosive occipital headache. So option D, explosive occipital headache is correct answer. Question number 316. A nurse encourages a client to join a self-help group as a part of the treatment plan. So what is the purpose of having the group therapy? Option A, sport, option B, confrontation, option C, psychotherapy, and option D, self-awareness. So option A, sport is correct answer. So which is the main purpose of having the group therapy? Question number 317. A nurse has limited time to teach an adult post-operative client. So which of the following is the most priority nursing action? Option A, establish learning needs. Option B, answer the client questions. Option C, provide brochure and handouts. And option D, make a referral to outpatient resources. So option A, establish the learning need is correct answer. Question number 318. Which of the following terminologies refer to unexpected increase of an infectious disease in an geographical area over extended time? So option A, endemic, option B, pandemic, option C, epidemic, and option D, sporadic cases. So option C, epidemic is correct answer. Question number 319. Which of the following school health team provide the health education about accident prevention? So option A, doctor, option B, nurse, option C, administrator, and option D, social worker. So option B, nurse is correct answer because in school health team, nurse plays very important role in education. Question number 320. Which action a nurse needs to include when caring for a newborn receiving phototherapy? So option A, expose all body surface. Option B, prevent stimulation. Option C, cover the eye with shield. And option D, change position every 4 hourly. So option C, cover the eye with shield is important. So option C is correct answer. Thank you.